Understanding chronic myeloid leukemia, CML, causes, signs, symptoms, and treatment. Chronic myeloid leukemia, CML, is a type of cancer that affects the blood and bone marrow, characterized by the uncontrolled growth of myeloid cells. It is associated with a specific genetic abnormality known as the Philadelphia chromosome. Here's a comprehensive overview. Causes. 1. Genetic abnormality. Philadelphia chromosome. CML is primarily caused by a genetic mutation where parts of chromosome 9 and 22 swap places, translocation, leading to the formation of the BCR-ABL1 fusion gene. This gene produces a protein, BCR-ABL1 tyrosine kinase, that promotes uncontrolled cell growth. 2. Risk factors. Radiation exposure. Previous exposure to high levels of radiation increases the risk of developing CML. Age. CML is more commonly diagnosed in adults, with a peak incidence in the sixth decade of life. Signs and symptoms. Early stage 950. Often asymptomatic and diagnosed during routine blood tests. 1. Fatigue. Persistent lack of energy. 2. Night sweats. Profuse sweating during sleep. 3. Weight loss. Unintentional and significant weight loss. 4. Abdominal fullness, due to enlarged spleen. 5. Frequent infections. Increased susceptibility to infections. Advanced stage 950. 1. Bluish or pale skin, due to low red blood cell count. Anemia. 2. Easy bruising or bleeding, resulting from low platelet count. 3. Bone pain. Pain or tenderness in bones, especially in the legs. Diagnosis. 1. Blood tests. Complete blood count, CBC, detects abnormal levels of white blood cells, red blood cells, and platelets. Peripheral blood smear. Examines blood cells under a microscope for abnormalities. Bone marrow biopsy. Confirms the presence of CML cells and assesses disease progression. 2. Molecular testing. BCR-ABL1 mutation analysis. Detects the BCR-ABL1 fusion gene to confirm CML diagnosis and monitor treatment response. Treatment. 1. Targeted therapy. Tyrosine kinase inhibitors, TKIs, drugs like imatinib, dasatinib, and nilotinib block the activity of the BCR-ABL1 protein, reducing the growth and spread of CML cells. Second-generation and third-generation TKIs, used when initial TKI treatment fails or for specific mutations. 2. Stem cell transplantation. Allogeneic transplant, reserved for younger patients or those with aggressive CML who do not respond well to TKIs. 3. Supportive care. Blood transfusions, to manage low blood cell counts. Pain management, medications to relieve bone pain and discomfort. Antibiotics, for treating infections. Prognosis, varies widely. Prognosis depends on factors such as age, phase of CML at diagnosis, response to treatment, and presence of additional genetic mutations. Survival rates. With modern treatments, many patients achieve long-term remission or manage CML as a chronic condition. Follow-up care. 1. Regular monitoring. Blood tests, CBC and BCR-ABL1 testing, to monitor response to treatment and detect any signs of disease progression. 2. Management of side effects. Addressing and managing side effects of treatment, such as nausea, fatigue, and skin rashes. 3. Psychosocial support. Counseling and support services to help patients cope with the emotional and psychological impact of CML and its treatment.